Hi, my name is Amanda, and this is Kevin, and he's going to be my patient today, and we're going to show you guys how to do a neuro assessment for a patient that had a CVA, or a cerebrovascular accident. So before you do any skill, you want to make sure that you've checked your 10 mandatory elements. You want to check the physician's orders, identify your client by checking the ID band, and explain the procedure to the client. Allow for questions, make sure your patient understands by verbalizing. Review the procedure in the policy and procedure manual of the facility. Always wash your hands, gather all your equipment, provide privacy and safety, perform the procedure using good body mechanics, document your procedure, your findings, and the client's response. Keep the client's privacy by utilizing HIPAA, and report any abnormal findings to your instructor, the primary nurse, or the charge nurse. So we're going to go ahead and start our assessment. So how are you feeling today, Kevin?
Feeling good.
Okay, so I got a report from the nurse, and they said you were admitted last week for a stroke. Is that correct?
Correct.
Okay. Do you have any history of stroke in your family?
Yes, my mother died of a stroke last year, actually.
Okay. Now, are you on any type of medications for any other type of conditions?
No, I just take a beta blocker.
Okay. Now, the reason why I'm asking about his medication is because certain medications can affect his neurological status. Do you smoke or drink?
I do smoke and I do drink.
Okay, and now I'm also asking about his lifestyle habits because smoking can increase your risk for CVAs as well as alcohol. And the whole time I'm talking to him and asking these questions, I'm noticing his grooming, I'm assessing his level of consciousness, his speech pattern, and things like that. So I'm going to go ahead and ask you some questions regarding your memory. Can you tell me what the month and the date is?
May 6th of 2007.
Okay, and do you know who your primary care provider is?
Dr. Navarez.
Okay, and I'm going to give you 3 words. I'm going to ask you to repeat them. And later on in our assessment, I'm going to ask you to repeat them again, okay?
Okay.
Apple, chair, and street.
Apple, chair, and street.
Okay, and the whole reason I'm asking that is to check his cerebral cortex function. And so we're going to go ahead and check his pupils. So we're going to assess for PERLA, which is the pupils are equal, round, react to light, and they accommodate. So go ahead and look straight for me. So I want to make sure that both of his pupils constrict when I shine the light. I'm going to move this towards him, and his eyes are going to come together, and they're going to accommodate my pen light. Okay. Now I'm going to assess his facial nerves, his cranial nerve 7, to check for any type of paralysis. So can you smile for me? Can you puff your cheeks out? Can you wrinkle your face? Okay, and I'm also going to check his glossopharyngeal. Okay. Can you open your mouth and say ah? Ah. Okay. And I want to make sure his soft palate moves up and his uvula moves up at the same time. I'm also going to check his gag reflex. Okay, good. Alrighty. So I'm going to go ahead and have you swing over here and sit at the side of the bed, and we're going to check a few other things out. Okay, I'm going to go ahead and check his deep tendon flexion, so go ahead and have a seat. Okay. Okay. Good. Okay, good. You can grab both my hands for me. I'm just going to go ahead and assess for strength. Okay, go ahead and squeeze. Okay, go ahead and put your hands down. So what I'm going to do is I'm going to check your pain sensation. So I'm going to touch a portion of your arm, and it's going to either be sharp or dull, and I want you to tell me which one it is, okay? So can you close your eyes? Is it sharp or dull?
Sharp.
Okay, sharp or dull?
Sharp.
Okay, sharp or dull?
Sharp.
Okay, sharp or dull?
Sharp.
Sharp or dull?
Dull.
Sharp or dull?
Sharp.
Okay, now I'm going to touch a portion of your arm, and I want you to tell me what arm I'm touching, okay, and where my finger is.
My right hand.
Okay, right now.
My left arm.
Okay, right now.
My right arm.
Okay, right now.
My left hand.
Okay, now I'm going to go ahead and assess his gait, so I'm going to go ahead and have you stand up. Go ahead and take your time, and go ahead and walk down that way for me, 1 foot in front of the other. I'm just checking his balance and his coordination. Okay, and go ahead and stand with your feet together and your arms at your side. So I'm going to check for his
proprioception.
Proprioception. So I'm going to go ahead and check his body spacing and his ability to sense things around him. So I'm going to see if he's swaying or moving. And then I want you to bring your shin up to your heel. Okay, other side. And I'm just checking for his balance and coordination. I'm going to check your Romberg sign, so I want you to stand with your feet together. And with one hand, point to your nose. Other hand, and go ahead and do it with your eyes closed. Okay, and then I'm going to go ahead and have you copy me, so I'm just going to check for his coordination again and his ability to follow me. So go ahead and slap your sides like this, back, forth, faster, 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 faster. Okay, so those are the basic elements of a neuro assessment. Okay, everyone, we're going to do a short quiz on the neuro assessment. So, Anna, what is an example of remote memory?
Like the birthday.
Okay, and Daniel, what facial nerve is used to assess for facial paralysis?
That'll be cranial nerve number 7.
Okay, and then Sherry, when you're asking patients questions about their memory, what brain function are you assessing?
Cerebral cortex.
Okay, A+, yay!